Autologous bone marrow transplant. An autologous bone marrow transplant, also known as an autologous hematopoietic stem cell transplant, HSCT, is a medical procedure in which a patient's own bone marrow or peripheral blood stem cells are collected, stored, and then reinfused into the patient's body after high-dose chemotherapy or radiation therapy. This procedure is often used to treat certain types of cancers and disorders of the blood and bone marrow. Here is a detailed overview of the process. Indications: autologous bone marrow transplants are primarily used to treat conditions such as multiple myeloma, non-Hodgkin lymphoma, Hodgkin lymphoma, some types of leukemia, solid tumors like neuroblastoma, autoimmune diseases like multiple sclerosis. Experimental. Pre-transplant evaluation. Before the procedure, a thorough evaluation of the patient's overall health and disease status is conducted. This includes various tests and assessments to determine if the patient is a suitable candidate for an autologous transplant. Mobilization and stem cell collection. To harvest the patient's own stem cells, a process called stem cell mobilization is performed. This usually involves the administration of growth factors, like granulocyte colony stimulating factor, GCSF, to stimulate the bone marrow to release stem cells into the bloodstream. Stem cells can then be collected via apheresis, a procedure similar to blood donation, where the blood is drawn, processed through a machine to collect stem cells, and then returned to the patient's body. This process may take several days. Conditioning regimen. Once the stem cells are collected and stored, the patient undergoes a conditioning regimen. This regimen involves high-dose chemotherapy and, in some cases, radiation therapy. The purpose of this intense treatment is to destroy the cancer cells or diseased bone marrow and suppress the patient's immune system to prevent it from rejecting the transplanted cells. Stem cell transplantation. After the conditioning regimen, the collected stem cells are thawed and then infused into the patient's bloodstream, typically through a central venous catheter or a Hickman line. This is known as the transplant day. The stem cells will then naturally travel to the bone marrow, where they will begin to produce healthy blood cells. Recovery and support. The period immediately following the transplant is a critical phase. Patients are at increased risk of infection, bleeding, and other complications due to the weakened immune system. They may require close monitoring and supportive care, including blood transfusions and antibiotics. Engraftment. Engraftment refers to the point at which the transplanted stem cells begin to grow and produce new, healthy blood cells. This process can take several weeks, during which time the patient may continue to require supportive care. Post-transplant follow-up. Patients who undergo autologous bone marrow transplants require long-term follow-up care to monitor their recovery and manage any potential complications. This includes regular blood tests, imaging, and visits to the transplant center. Potential complications. Autologous bone marrow transplants are associated with various risks and complications, including graft failure, stem cells do not engraft, graft-versus-host disease, although less common in autologous transplants compared to allogeneic transplants, infections, organ damage, and relapse of the original disease. It's essential to note that while autologous transplants are less likely to cause graft-versus-host disease compared to allogeneic transplants, where the donor is not the patient, they still carry significant risks and should be carefully considered in consultation with a medical team experienced in transplant procedures. The success and appropriateness of the procedure depend on the patient's specific diagnosis and individual circumstances.